Hello EGP learners, hello Gandhi. Sorry I can't be with you live this evening, but I didn't want to miss the chance to share some tips about the upcoming conference season. So I'm going to give you my top three upcoming conferences and just let you know what those are. I'm going to talk about some key themes that I think will be coming through in the conferences, or that I'm particularly interested, at least. I'm sure there'll be a lot more than I mention, and then some of my tips for attending conferences.
Hello and welcome EGP learners. This video is part of a series of content that we've been putting out to support you all through the conference season, running sort of September, October and beyond this year. This video was originally filmed on the 12th of September. I'm clearly on holiday. Brownie points if you can guess where I am. We were originally going to put out a video where sort of Gandhi reacted to my comments and he was going to pull that together while I was away, but that didn't happen. We were all too busy in the end, but we thought it was quite a nice video and quite nice being filmed on location, and some of the content didn't come up in later videos that we made about conferences. So we thought we'd put it out as an independent bit of content. So I'll leave you with the original recording now. Here we go.
Hello EGP learners, hello Gandhi. Sorry I can't be with you live this evening, but I didn't want to miss the chance to share some tips about the upcoming conference season. So I'm going to give you my top three upcoming conferences and just let you know what those are. I'm going to talk about some key themes that I think will be coming through in the conferences, or that I'm particularly interested, at least. I'm sure there'll be a lot more than I mention, and then some of my tips for attending conferences. So upcoming conferences, so RCGP annual conference 24 in Liverpool. Really excited. I'll be attending that with Gandhi, hopefully doing some live videos and recordings with people from the floor, so that'll be really, really exciting. Best Practice Conference in Birmingham, that's my number two. Also perhaps because I'll be attending there with Gandhi and again, meeting delegates and hopefully doing some recording and EGP learning work as well. And finally, I'm interested in the Labour Party conference actually. The autumn's always the conference season for political parties, and obviously Labour in power, so their conference will be the big one. Wes Streeting, I'm sure, will have a lot to say about sort of big NHS policy issues and shifts. We've got the Darcy report coming out. I think it's just broke today actually, so I'm sure Gandhi might be talking about the three big shifts that they're talking about: hospital to community care, analog to digital, and from treating sickness to preventing sickness. Themes that we've heard before, but interested to say that they'll probably be three of the big focuses going forward. So discuss, and then now key themes coming through that are of particular interest to me. So I'll be interested to gauge people's response to any big NHS policy announcements that have been made in the Labour Party conference, because that precedes the RCGP conference, which precedes Best Practice conference. So there may be some responses to the Darcy report and so forth. So it'll be really interesting to know how those are landing. We also tend to get speeches from key people from within NHS England, and sometimes politicians at these conferences. So I'll be interested to see what they have to say to sort of manage our expectations, what's to come, and think about what responses are happening to those announcements. Theme number two, interested to know what's happening with GP industrial action and the state of general practice. So we're really keen to get a sense of what action's being taken by GPs in different parts of the country, and in particular how well or how not well they're coordinating that. Are they coordinating with each other, practice to practice? Are they coordinating at PCN level, and what's happening at kind of ICB or regional level? So really interested in how that's going. I'm particularly interested to have conversations around, is it possible and how do we continue to improve patient care and that interface between secondary and primary care, and the use of data to drive improvements in care in an environment where there's a lot of legitimate pushback from GPs and industrial action happening. So I'll be interested to see how people are having success in that area. Also be really keen to talk to some newer GPs, get a feel for how the GP employment crisis is affecting them and how they're finding things at the moment as well, because it's something that we talk about a lot on EGP learning. Theme number two, for me at least, integrated neighbourhood working, integrated neighbourhood teams. So I'm involved in some work in Nottingham in that area, so I'm keen to learn and get ideas from what's happening in other parts of the country, and maybe share a little bit about what's happening in Nottingham with them too. And big theme number three is tech. So there's always lots of tech stands, providers of technology solutions to general practice present, either contributing through presentations or in the sponsors area. So keen to get a sense for how technology continues to change the way we work and what's around the corner. I'm particularly interested in AI triage and remote consultation solutions. It's something that we're kind of always looking at the practice. Note-taking and summarization, so kind of the evolution of dictation, I'm really interested in. Apps that support patient behaviour change. So I'm developing a new interest in that area because of some cardiovascular disease work that I'm involved in Nottingham, and interested in how that might play a role. And also I'm particularly interested to see what's happening with the evidence base around the use of some of these new technologies. Particularly to provide clarity about impacts and improvement on patient care and outcomes, and other benefits for using the technology. Are they really cost effective? How cost effective they are? One imagines that they are, but I'm really keen to see if someone's done some evidence around that, and also evidence around the impact on the workforce and how it affects our working lives, as well as the impact that it has on patients. And I'm also keen just to pay attention to the presence of big tech at the conference, particularly as it relates to big pharma, the level of influence that they're having on the agenda, and the number of stalls that are present in the sponsors area. The influence of big tech on commissioning and spending decisions in the NHS is something to watch, I think, carefully. But of course, there's still loads and loads of potential with tech. So finally, moving on to some of my key tips. So I think really I would be really sort of planned and purposeful to the approach to a conference. Think about what problems you are having or that you need to solve in your roles. So these might be things like remote consultation solutions, probably drawing on my own experiences here, but your mileage will differ in other areas. Dictation solutions, staffing and looking after the workforce, and maybe make some connections with local agencies. Might be particularly clinical challenges that you want some support with at the practice, organisational challenges in terms of how you're organising, running your GP surgery or your primary care network or your larger organisation. I know there's lots of stands, people like Tara Humphreys, friend of EGP Learning, can help a lot with primary care network organisation in particular, and moving into primary care space or moving into the general practice space as well. And also population health challenges and how people are approaching those. Also, think about what you've got to share. So it might be interesting projects, interesting quality improvement work or service development that you've been involved in. And also think about what your opinions are and your perspectives on some of the key themes in general practice. It might be ones we talked about earlier, might be things that you're particularly interested in, say things like the workforce crisis, maybe the shift of focus from away from practices towards PCNs, of funding and kind of attention within the NHS. I think that's an interesting tension line. So if you do this homework, then that will make you into a purposeful and interesting person when you attend the conference. So then make sure that you plan your agenda and your schedule and what sessions you're going to meet the needs that you've identified. And it also means you can have a strategic approach to which stalls and who to engage with on the sponsorship area. So I think it'll help you be more purposeful with that. And then also, it'll make you an interesting person when you come to speak to people, because you'll have got some talking points. If you're an introvert, sometimes you need to kind of plan those interactions a little bit more. So use your challenges, use your shareable or teachable points from your own experience, use your opinions to have useful interactions that are helpful for moving you forward in your challenges, and hopefully give something to the other person as well. Finally, it is EGP Learning. Gandhi will be talking about tech tips as well. So he'll have lots to say on that, but my key thing is I like to use a phone or a tablet, tends to be my phone these days, to make notes throughout the conference. It's so much easier. You can make notes, yes, in the presentations, but also as you're kind of going around seeing things on stalls just after you've had conversations. And it's so much easier to take and insert photos of key slides or information into your notes as well, or you can record some video, you can record some audio from presentations as well. Most of the time people are really relaxed about that, and of course it's a lot more portable than a laptop and other solutions. And also take a battery pack and take a suitable cable to recharge on the go, because you can really burn through your batteries at these events. So sure, Gandhi has had lots of other things to say as well. Hopefully that was helpful, and hope you had fun this evening. Okay, continue to tech enhance your primary care and learning. Bye bye.